The arrival of a child is usually a joyful occasion for both the parents and the community. But in Busia and Samia districts, the malaria, tuberculosis and HIV/AIDS pandemic had taken their toll and replaced the once joyful celebrations with a bleak uncertainty. This was until AMREF and consortium partners intervened with the Child Survival Project. The results are very encouraging indeed.
The indicators for child survival were quite low in Busia. Immunization was low, women were not delivering the health facilities, malaria was quite high, and these were the reasons why AMREF actually wrote a proposal that was supported by USAID to try to turn the indicators into better indicators.
By employing the community health strategy, AMREF, working closely with the communities to try and mobilize them to be able to take their children for immunization, pregnant women to be able to deliver in the hospitals, and get skilled assistance, all of which have borne fruit. The project intervention areas are in maternal and newborn care, malaria, and HIV/AIDS. The project purpose is to contribute to sustained reduction of child and maternal mortality and morbidity. Mothers used to give birth at home with the help of traditional birth attendants, but now in the 2 districts of Butula and Samia, the communities have embraced quality antenatal and maternity services at health facilities.
So the key highlights of this project is really building community health units, working with community health committees and training community health workers and community health extension workers in Busia and Funula. We have so far trained nearly 1,000 community health workers, which is one of the biggest group in any particular area that have been trained to provide these services, to increase malaria control in terms of case management and also access to insecticide-treated nets, and mobilizing mothers and doing household visits to encourage mothers, pregnant women, mothers to attend an neonatal clinic and to deliver at health facilities. In terms of counseling and encouraging them to go for HIV testing has been one of the key highlights of this project.
Trained community health workers and community health extension workers are key in future project sustainability. Community health workers have been trained to take care of pregnant mothers. They have in turn imparted vital child survival information and skills to mothers in the target community.
Na kwenye hizo vikundi huwa wanapewa mafunzo juu ya umuhimu wa kujifungulia kwa hospitali na jinsi ya kutafuta huduma mara tu wanapohisi watoto ni wagonjwa.
Mother-to-mother communication has been very successful, especially in helping with the birth plan of expectant mothers.
In view of this, the ministry is keen at scaling up that intervention of home-based newborn care. It has benefits to the newborn and to the mothers alike. We have the structures in place, the government is willing, the policies are in place, we have the guidelines. I think there's nothing that will stop us from moving on.
Another major focus of the project was to build capacity to combat and control the spread of malaria in the 2 districts of Butula and Samia. Mothers are issued with free treated mosquito nets when they take their children to the clinic. Additionally, school children have been encouraged to form health clubs to help cascade information about malaria prevention, treatment, and control with practical examples among the community.
As you know, malaria is one among other communicable diseases. What do I mean by communicable disease or diseases? What are communicable diseases? Yes.
The project strategy also included imparting information vital for embracing best practices to combat and control the spread of HIV/AIDS to newborns, the youth, and the community generally.
Which type of people are at a risk of being infected by HIV?
Everybody is at a risk of getting HIV/AIDS.
Yes, is she right?
Over the past couple of years that the program has been running, several achievements can be identified.
Ideally, we have achieved in terms of immunization has gone up. Women delivering or as skilled assistance has gone up in Busia. A lot of people now are using insecticide-treated bed nets. The community health workers have been trained. And of course, according to the AMREF strategy of community partnering, AMREF has partnered with the government, the other NGOs working in the area, other CSOs, to be able to improve the status of children and mothers in Busia.
USAID have walked side by side with AMREF in this project and are happy with the work thus far.
We've been happy with the Busia Child Survival Project. I think it has achieved what it intended to achieve. As far as breastfeeding is concerned, they started off in an area with very low breastfeeding, and that definitely improved over time. I'd say too that practices around child nutrition also improved, and malaria prevention in particular improved.
All in all, members of the community view this as a successful project that will be able to be self-sustaining.
The sustainability of the project, it's there, and me, I have high hopes that it's going to continue, because there's ownership. There's ownership within the community, because you'll get that the community themselves, they still have those strong structures that were put there.
The project's objectives, which once seemed daunting, are now a reality, and Busia District and indeed the country as a whole can look forward to a brighter future.